Hi, my name is John Betjemann, and I'm an assistant clinical professor of neurology at the University of California, San Francisco. I'm pleased to be able to present our recent article entitled "The Diagnostic Yield of Electroencephalography in a General Inpatient Population," which appears in the Mayo Clinic Proceedings. Our study addresses the rate of seizures in a non-critically ill general medical inpatient population. As such, we feel it appeals to a broad range of reader, including community-based and academic internal medicine physicians, as these are often the first physicians to evaluate such patients. We know that the rate of seizures in the medical and neurologic intensive care unit is quite high, but we have very little information about the rate of seizures in a general inpatient population. In addition, we feel that EEG is an underutilized diagnostic tool, owing largely to the fact that it's scarce at most hospitals. The aim of this study was to document the rate of seizures in this non-critically ill population, as well as the rate of epileptiform abnormalities on their EEG. We also aim to identify which clinical variables may predict seizures in an effort to better utilize this resource-intense test. Our study was a retrospective study that took place over the course of 5 years at our tertiary care medical center. We focused solely on the non-critically ill population and therefore excluded anyone who was intubated at the time of their EEG. We gathered demographic and clinical data from the medical charts in an effort to identify which clinical variables predicted seizures. We also carefully reviewed all the EEG reports for ictal and interictal abnormalities. We noted the duration of the EEG and identified at which time the first seizure was noted. We screened 2,235 patients and were able to include 1,048 patients. Our main finding was that 7.4% of the patients experienced at least one seizure during their EEG recording. Epileptiform abnormalities were identified in 13.4% of additional patients who had not experienced a seizure. We felt that this was an important finding because it places these patients at an increased risk for seizures. We found that a prior history of epilepsy, as well as a diagnosis of a brain tumor, were associated with a higher likelihood of experiencing a seizure. We also noted that EEGs that were ordered for an indication of spells, as opposed to altered mental status, were associated with a higher rate of seizures. When we looked at the duration of EEG and the time to first seizure, we found that about 65% of patients experienced their first seizure within 1 hour of the EEG recording. This number increased to about 89% with 6 hours of EEG recording. Nearly all patients experienced a seizure within the first 24 hours of their EEG recording. In summary, we found that approximately 7% of the non-critically ill general medical population experienced a seizure. We noted that an increased rate of seizures was seen in patients who had a prior history of epilepsy, a brain tumor, or spells as an indication for their EEG. In addition, we found that a high percentage of patients who experienced a seizure did so within the first 1 to 6 hours of their EEG recording. We feel that this underscores the relatively high frequency of seizures in this non-critically ill population, a finding that seemingly was underappreciated by neurologists and non-neurologists alike. We feel this is an important finding because seizures represent a potentially treatable and reversible cause of altered mental status in this population. Of course, our study is somewhat limited in that it is retrospective in nature. Future research in this area should investigate prospectively how long to monitor patients for seizures, as well as which clinical variables are predictive of seizures. I'd like to thank you for allowing us to share our work.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.